Hi everybody, this is Michelle from Virtual Hand Care, and in this video I'm going to show you a scar taping technique that you can do if you have had a broken wrist, maybe you had wrist surgery or maybe a hand surgery. You can also use this technique. So go ahead and grab yourself some kinesio tape, muscle aid tape, K-tape, paper tape, any kind of tape that is skin friendly will do. And make sure you grab yourself some scissors and also wash that area really good as well, and that will help the tape stick. Now, disclaimer, always make sure your incision is completely healed before you apply any tape. So I went ahead and pre-cut a strip. As you can see, you just need a very small piece of tape for this technique. So I took 2 blocks of tape and I cut it this way, and then I also then cut it long ways so that you just have a very small 1-inch piece, and that's really all you need, just enough to cover that scar. In order to tell what kind of direction you need that tape to be, you're gonna have to touch that incision. You're gonna have to move that scar around and feel if you feel any kind of adhesions. So I'm gonna just show you a directional pull in this video. There's many different types of taping techniques, but we're just gonna do this one technique in this video. Basically, the concept, if you find that there is an area that is sticky, you will want to start the tape on the opposite side of where it is sticky. So say I feel a lot of adhesion kind of up into the hand, closer to the palm here, which is a very common spot when people have a distal radius fracture surgery. It's just that skin is just so thin and fragile right there. So then what we're gonna do is we're actually gonna start our anchor point at the opposite end, and then we're gonna pull up towards and past that adhesion. That will allow a little pull in the opposite direction of where we have that sticky point. So I'm gonna show you that technique up close. So what we wanna do is we wanna take that tape and we wanna just tear a little piece first. So we get a little anchor piece, okay? And then we're gonna remove that backing. So we're gonna go a little bit lower here, and we're gonna just kinda stick that on and rub that so that sticks a little bit better. Okay, now what we want to do is get the rest of that paper tape off on the back, but don't remove it completely. Go ahead and place your scar or your wrist back a little bit. That will put a little bit of tension on your scar as well. And then you're gonna go ahead and apply about a 25 to 50% tension all the way up past that adhesion of your scar, and then you're gonna rub that in. And now, because we have placed that first piece on the opposite side of the sticky part and then stretched over the sticky part, now the tension of the tape is pulling in a different direction, in an opposite direction. So as you can see though, the tape doesn't limit. You can get it wet, you can still do your exercises with the tape, but the tape will constantly be on there and will continue to work and continue to apply some nice tension, not too much tension, but some nice constant tension on that scar tissue to release from the structures underneath your skin. And hopefully you will start noticing some more skin mobility, less scar sensitivity, and more range of motion if your scar is restricting your motion. I do have another scar taping video that I will link here, so you'll definitely want to try that technique out as well. Like I said, there are so many different types of taping techniques. It's really just a matter of what exactly your scar needs. Now, I hope you found this video helpful. If you did, please give it a like, and don't forget to hit that subscribe button below and check out these videos here that YouTube is suggesting for you. Thanks for watching.